Good afternoon, everyone. Thank you for joining me today. We are going to have a little fireside chat, an educational webinar about the power of patient recalls. Thank you for joining us. Joining me today, let me introduce myself first. My name is Alisa Vaughn. I'm the Senior Vice President of Revenue Expansion Operations here at Office Practicum. I also have with me that you can see Kateri Haskett, who is the CEO at Pediatric Associates of Kentucky. As the CEO of the largest independent pediatric practice in Northern Kentucky, Kateri is going to share her insights with us today on how pediatric practices can use recalls to improve patient care and immunization rates, plus generate a little additional revenue, which is important as we plan for the future growth of our practices and caring for our community, I also have with me today Susan Hannon, who is our Senior Solutions Engineer at Office Practicum. She will be demoing OP's patient recalls for us a couple of times today as we discuss the power of recalls in your practice. So our goals for today is to educate pediatric practices about all of the useful things that can be gained by running recall reports in OP. So just to give you some highlights, we're going to learn how to quickly and easily identify children who are due for well visits and immunizations, how to utilize our demographic analysis recall. You might hear Kateri and I, who use this, reference the demographic analysis and recall as the DAR throughout this webinar, but we're going to take a look at how to report and handle 2-dose vaccines and manage chronic care, how to use recall reports to support the expansion and development of your practice, and then, of course, how to identify new revenue streams for your office. So let's kick things off with a little poll just to see what we are all doing in our pediatric universe. So you should have a polling question coming up. How do you find kids in your practice who are overdue for well visits or vaccines in your practice? So please select one of the following. Okay, so I'm proud of all of the practices out there who schedule well visits before they leave. That is phenomenal, and that is a great practice that every practice should be in. As a matter of fact, prior to joining OP, I was a practice administrator, and we were fortunate enough that our actual providers would schedule the next well visit in the room while they were in the EHR at the time of service. But if not, doing it at your front desk is really great. I'm also very proud to see that there is a good number of folks on this webinar today that are using a recall report in their EHR. So Kateri, what I'd like to do, if you don't mind telling us a little bit about yourself and your practice, and all of the ways that you use recalls in your practice to keep kids on track for well visits.
Sure. So I'm Kateri Haskett. I've been with Pediatric Associates for 30 years. We have 3 locations and 27 providers. And so lots of moving parts, just like every pediatric practice. We use recalls every day. So we use it as a tool to send out kind of ad hoc. When we know we have enough staff, we'll send out recalls, and we'll either send them out, we build our schedule 6 months in advance, so we'll either send them out 6 months, or if we see that we have some openings in the schedule, we'll send those out for patients that we know need a well checkup within the next 6 weeks. And so we can really hone that in and generate calls for the people that need to come in right now if we have appointments available right now. So that's a nice thing to be able to do it, kind of looking out further, or filling our schedule for the next couple of weeks if we have availability there.
Yeah, plus you're keeping those kids on track with the AAP periodicity schedule as well. So that's really great. And are you able to, in your system, when you're talking about filling the gaps in your schedule, you're recalling those children, do you also ever use it just for vaccines alone, for example, flu vaccines, rather than just well visits?
Absolutely. So yes, we use it to see who's already had their flu vaccine for the year, who still needs it. And so sending out targeted recalls for that. Or if there's a 2 or 3 dose series of vaccines, that we can target those that haven't started the series, those that have gotten 1 of 2 doses or 2 of 3 doses, and send things to them, and send really specific messages that say, hey, you got this one vaccine, and to finish the series, here's what you need. The other thing that I do is the messages we send out are specific to that age. So if we were sending one out to 11-year-olds, then we know that at 11 there are specific vaccines that those kiddos need for school. And so we can say, for your 11-year checkup, it's really important that you come in for these vaccines. And so really personalize it, because as you said, Alisa, really keeping them on track with what they need is so important. And that lets the parents know why it's important they come in for that visit. Because everybody's busy, and it's easy to kind of get lost in the shuffle of, oh, my kiddo's healthy. I don't need to get in for a checkup right now. They're healthy. And it really is important.
It slips my mind. I have to admit, as a mother that works full time, my son, when he started his HPV vaccine, I couldn't remember and keep up with the schedule of when he needed to have his first, second, and third dose of the vaccine. So I got messages from my own pediatric practice, likely through the recall system, and it was so helpful to remind me, because as you said, my son was healthy, we're happy, we're just moving along with our daily lives. And that was so helpful for me to get that kind of a message that was individualized for my practice. Speaking of the specificity and the dynamics of recall reports, in addition to filling up our schedules, keeping kids on track with their well checks and vaccines, it's also very useful in managing chronic illnesses such as asthma, or keeping kids on track for ADHD and other care plan managements. Susan, when she comes on to do a demo here in a little bit for the audience, will demonstrate what that looks like. But Kateri, do you regularly use that in your practice for chronic care and care plan management as well? And have you seen any difference in the quality of care that your practice is able to provide for those type of visits?
Yes, absolutely. As you said, ADHD and anxiety medications are the ones that come to my mind. It's so important that we keep those kids on track and that we see them more frequently that first year when they start on a medication, but every 6 months after that. And so sending out those reminders not only helps those parents stay on track, it also takes that stress out of, oh my gosh, I need a medication refill and I forgot about it. And it takes the stress off the office when that parent isn't calling in the 11th hour wanting that refill. And we're like, oh, we haven't seen them in 6 months. We really need to see them for their well-being before we refill that prescription. So it takes the pressure off everybody by being able to do those recalls that are so specific that we can see this is a patient that needs to come in every 6 months, and we haven't seen them for a med check or a well visit in 6 months. Because even if they were in for a sick visit, we probably didn't do those things we need to do to be sure that it's appropriate to continue on that dosage of medication.
Yeah, and I imagine for practices, I'm not certain about your practice, but for practices that have P for P dollars or incentive dollars tied to care plan management, making sure that your patients are compliant with your care plan is really important to make sure that you get those incentive dollars as well. So I think that's great. One of the things that I used to use, I don't know if you've done this or not, Kateri, but it was so important to me, speaking of managing care, when I would get a notice from a drug manufacturer that a specific medication had been recalled, being able to quickly identify patients on medications that might be recalled and quickly get to them as the provider rather than the pharmacy. And again, giving that level of attention and care when something like that comes up was so important to me in my practice. So have you ever had to use it for something like that too, that's kind of outside of well care visits and vaccines, but also critical to quality patient care?
Yes, absolutely. I mean, like you said, certainly a recall, but also there are times when medications aren't available, and being able
Oh
to
yeah,
pull
that's
that in,
true.
and see that, hey, this person's on this medication, and they're going to go to the pharmacy and wonder what to do. So to send out a recall, but it's through the same system, but it could just be an informational message that says, hey, we know that you're on this medication and you're not going to be able to get it. These are the alternatives that we recommend for that. So that's really good. The other thing that I think of that we've done is we switched one of the medications that or one of the vaccines that we were using, and really wanted to get all those kids on the previous vaccine finished with their series. And so being able to target that and really get those names and who needs it and when they need it, so we could transition our office to the new vaccine and still respect that, because there wasn't the ability to interchange those two vaccines. So those have been really powerful ways to just make care better for our patients. And you said it perfectly. It's so great if they can get that information from us, get it sooner, more directed than waiting until they get to the pharmacy to find things out and to wonder, or to be calling in. Being proactive is so good for everybody in those situations.
Absolutely. Proactive communication from my pediatrician, for me builds trust. Although my son has been seeing the same pediatrician since birth, but I love and I stay with that same pediatrician because he does communicate with me regularly, because I do get these kind of updates. And so, a lot of times as a consumer of healthcare, even myself as an adult, but more importantly for my child, knowing that I am being paid attention to and my child's health and wealth is being paid attention to, and I'm getting those proactive communications is so critical to the trust, who you trust your child's care to. You mentioned, I never did that, Kateri, but I think that's a really good point about, switching vaccines, and you still have the prior vaccine on stock. And as we know, vaccines outside of personnel and payroll is one of our largest expenses. So being able to recall and use those vaccines also helps us from a financial perspective, not just that quality care. So let's go ahead and bring Susan on, and let Susan demonstrate to the audience what Kateri and I were talking about, about how easy it is to run these recall reports, but also how to make them specific to your needs and what you're trying to get out of the system. Thank you, Susan.
No problem. All right, so I've gone into OP. For those of you who are already on OP, you're going to go into your practice management and your demographic analysis and recall. And from here, you can have a number of choices. You can look at all of your kiddos that are active, or you can say, I only want to look at the kiddos who've had at least one appointment since a specific date. So we're going to, for my demo site here, we're going to pull all of our kiddos up. From here, you can make any choice that you want. You want to recall your kindergartners, you want to recall all of your patients. You can actually then decide what part of my demographic population do I want, or do I want everyone in here? And for our demo today, we're just going to pick our little ones. And so from here, I want to do a care plan recall. And as we know, all of our kids that are in OP are automatically enrolled in a care plan called Bright Futures, which in essence is the periodicity table built into the program. And I'm going to recall them for preventative care. I can pick whatever date it is that I want to recall them they're due by, and it simply runs through all of those kids and says, here are all of the kids that match this criteria. What is really nice is that it isn't just recalling kids on that annual visit, the every 12 months. It's recalling our kids, my little ones here, based on the interval that they need. So that 1 month, 2 month, 4 month, all of those visits, all the way up to age 3, we know we have a significant number of them. We're going to get those kiddos in for that visit, which is good medicine, but it's also good business as well. The other part of this is vaccine recalls. So when Kateri and Alisa were talking about vaccines, we can recall our kids based on all different statuses in their forecast. So just reminding everyone that that forecast that we see everywhere in OP on our appointments and on our charts is based on the ACIP or the CDC schedule. So in this case, I'm going to pick everyone who's behind or due for a specific vaccine. So yes, the scenarios that we talked about earlier are a huge one that we use it for, but we've also had, we all know, different epidemics, unfortunately. Last year it was an epidemic of polio in New York. I want to make sure I get my kids in and protected. So I can simply run this recall based on whichever demographic population I have, and that quickly it's giving me all of my kids that are behind or due as of today's date or whatever date we selected. And again, I can send a blast message out to these kiddos. So the ability to really reach this population is critical. Now, the only other thing that I want to show you before we jump back to our panel is Kateri and Alisa mentioned the ability to recall kids for other things. So it's as simple as, here are my medications. So I want those kiddos that are on a current medication, or I need a list of kiddos that have a current problem. I want my asthmatics and I want to send that message. All of these things are completely here in OP, as well as all other care plan items that you may have. So our ADHD kiddos, our asthma kiddos, our weight management kiddos, the ability to manage that care and ensure that they come back into our office is really a critical item for us. And with that, I'm going to send this back over to our team.
Thank you, Susan. Yeah, it's amazing. I used to love to play in the DAR because the possibilities are truly endless. Not agree, Kateri. It's almost like running a report and figuring out, oh, what can I find next? It's super cool. I love it. So now we can move on to poll question number 2. As we move into the financial and operational side of running our practices. So how do you decide when it is time to add a new provider or open a satellite office at your practice? This one should be good. I'll give everybody a few more seconds, then we'll see what we've got here. All right. So Kateri, would you mind giving us some insight into how you might use the DAR to decide on when it's time to add a new provider or open a satellite office, or maybe expand upon what we mean when we say we look at how busy our doctors are?
Sure. I think all 4 of those are important things. What I recently discovered, kind of what Alisa was saying, when you run that report, you know there's data in there and it's just figuring out how you can use it. What I did is I looked at how many kiddos weren't getting their checkups at that 12-month mark, assuming they're due annually. And as Susan pointed out, some the younger kids need them more frequently. But really looking at, if we were capturing these people closer to the 12-month, or that are skipping a year or 2 on checkups, what is that real number? So even if our current doctors are full, but if we could capture 50% of the people who are skipping a year, or bring those patients in at 12 months instead of 15 months, how many more appointments is that? How much better medicine could we provide if we had an additional provider that we had the availability where we could get those patients in, and those parents could schedule at the times and days that worked for them, and really increase the quality of care we could give, and financially have it make sense to have a new provider. So running that DAR and being able to see the potential in there was really valuable for me in looking at that. The other thing is looking at locations. So I have 3 locations, but do I need to shift a doctor from one location to another? So with the DAR, I can run a report based on zip codes, and I can look at that and I can say, wow, you know, X% of my patient population is here. Does that mean that X% of my providers should be here? Well, we all know that those younger kids tend to come in more frequently, not just for checkups, but for sick appointments. So I can look at it based on the age of my population too, and start making decisions based on that.
Yeah, I love it. Again, I sound like a broken record, but the possibilities are endless here. And I think the first step, no matter what tool or system you use, is to be curious and to run the reports and ask why. And for me, the DAR just really put the power in my fingertips to be as curious as I wanted to be. And it's interesting that you said running the report by zip code, because when you have multiple locations or even a single location, and you're looking at marketing your practice, or you know, am I seeing enough new patients? You can really narrow that down by demographic, right? The zip code, and where all of your new patients are coming in at as well. And that's something that's super important. If your practice is open to new patients, are new patients in one of your locations at one zip code not able to get in, you know, for 4 weeks, which is quite a long time, but you have new patient openings on your schedule if your schedule template is set up that way, and other locations that aren't being filled. So again, to your point, how do I shift my resources to the location or area where there's a need? I love the looking at how busy your doctors are, and the first two kind of tie into that. How busy are we? How many practices or how many patients are we bringing in a year? But I think it's also important when we're talking about this that we look at being able to quickly identify the ages of your active patients to ensure that you're bringing in enough newborns to kind of fill the gap for those patients who may be aging out of your practice. So in my practice, we had a really tough time letting go of our college kids. We wanted to keep them around for as long as we could, but inevitably our patients do age out. Do you use the DAR, Kateri, to look at newborns for your locations?
Absolutely, we do. We look at our newborns, the aggregate number, and by location, so we can see where they're coming in and where our growth is, certainly, and just helps us with planning. And I think you use the perfect word, Alisa. You use the word curiosity, and it's sometimes I find the curiosity starts with a thought, and sometimes it starts with a DAR, where I see things and then I have to my mind goes to the curiosity of why, how, what, and what can I do with that information? So I do think curiosity in that is so important to utilizing everything that's there, and doing things like this where we all learn from each other and get different ideas of what and how to use things.
Absolutely. I believe that there is no better way to educate yourself than by speaking to others in the pediatric community. I have learned most of my knowledge from peers and friends in the field over the years, and then taking what I learned from them, and then got curious in my own practice. So I love that. And speaking of curiosity, and when we talk about the financial impact and how you can use the DAR for this, I think it's important that we also discuss how the DAR can be used to quickly generate your payer mix within seconds. We could tie this all the way back and go into the weeds of getting paid, 100% of your allowable and your fee schedule. And if you notice that, if your posters or your billers in the office who should be looking at that when they pull those remits in, they match up the claims, and then they're going to post payments, if they alert the practice, if you're not regularly running those reports, if they alert the practice administrator or the physician owner of the practice, like, hey, we're getting paid 100% of our fee schedule here on Blue Cross Blue Shield, wouldn't it be nice to be able to quickly say, well, what's the percentage of Blue Cross Blue Shield in my practice? Do you ever use it to look at your payer mix? And if so, what are kind of some of the learnings and the lessons that you've identified to help make some changes in your practice?
Sure. Knowing our payer mix, I think, is so important. The first example that comes to my mind is, as we all know, Humana is stepping out of the commercial market. And so when we all heard that, it was, okay, what impact will that have on us? What percent of our patient population is that currently? And what do we think is going to happen to those patients? Where is that going to be distributed? And what does that look like? And yes, knowing that it's most important to be sure that we're capturing all of the potential revenue from our largest percentages. What does that look like? We've also been approached from some smaller insurance companies who said, hey, are you willing to do this? Are you willing to work with us on that? And to be able to look at our payer mix and kind of get an idea of where that payer would probably fall, and kind of do an analysis and say, okay, is it worth it for us to change our model, to be a little flexible on this? What does it look like? The other thing we just started doing is building a self-pay fee schedule based on the fee schedules that are already there, and seeing how that lines up so that we're being fair to our self-pay patients and yet being fair to ourselves financially at the same time, and looking at that balance, and what those things mean to us, and what it means if we're negotiating contracts. Is this a payer that I'm gonna spend a lot of time preparing for negotiation because it's a huge percent of my patient population, or is this 5% where it's important, but you know what, I need to be sure that I don't get sucked into the vortex and spend too much time on that.
Yeah, especially if you know kind of the demographics and where your patients are coming from. And if you do identify, like you're talking about, that this is really going to impact 5% of my patient population, which, you know, was likely no small number in your practice and size, but how do I prioritize that based off of the information that I'm getting back from my recall report? One of the things that I used to love in my practice with the demographic analysis recall was really cleaning up my patient panel. And I think that that's so important when we're talking about not only quality of care, but financial impacts. So when we're looking at, we run a report to look at our entire population. Do you really know what your population is if you're not cleaning up your patient panels? So what I would do in my own practice was I would run the recall report and say, you know, how many of my patients have not been at my practice in 2 years? And I don't know what the common rule is, but in my practice, if you haven't seen us in 2 years, you're no longer a patient. And when you come back into the office, you would be considered a new patient. So in my practice, we were 67% Medicaid, and we had a lot of P4P. We were a level 3 patient center medical home, and we would get those reports back from Medicaid or our CMOs that would say, here's the list of your patients. And this percentage of your patients are non-compliant. Therefore, we're only going to pay you X amount of dollars for the patients who are compliant on your list. What was really nice for me is that I would keep my patient panel list very clean, and I would report and report back to my Medicaid payers when they had my panels listed incorrectly, to make sure that I was capturing all of those incentive dollars for quality care, because there's so much money we can leave on the table if we're not looking at what is our true patient population. How do I keep that clean? Because if we're going on just our entire patient population alone, when we're deciding when to add a provider or a satellite office, are we making decisions based on accurate data? And so for me, using that recall report in order to keep my patient panel clean and up to date was really important. So do you have any other tips for us, Kateri? At the end of this presentation, we will go over and share some resources with you, but there's a really good case study that was done on Kateri's practice and the many ways that she used the demographic analysis recall to manage care and operational practices. Do you have any other things, Kateri, that you think is important to share with us as it relates to the recall reporting and the power of those?
Great point on the panels. Absolutely, Alisa. The other thing that we use it for, we fairly recently, we decided that 21 was the age where we would start asking patients, or we would tell patients at 21 we would no longer see them. We want to give them forewarning. So we use the DAR, and they get a letter in the month they turn 20 that tells them, hey, you got a year. We still want to see you this year. That's great. But start planning. You got a year. And then 2 months before they turn 21, we let them know, hey, 2 months from now, when you turn 21, we've really loved caring for you, but sorry, you probably don't want to be sitting in the Sesame Street room, and it's not where you belong at 21 anymore. So really hard decision on our part. The other thing that we started doing with our older kids, if you will, is at about 17 and a half, we send a letter out to them. We use the DAR to generate the list. We send a letter out to the parents, actually, at 17 and a half, letting them know that at 18, guess what? Your baby is an adult. And so it's the warning that things change at 18. And at 18, unless your child lets us know that we can talk to you, we can't. So it's just that building trust, like you mentioned earlier, Alisa, that, hey, we know it's hard. It's just what we have to do when they turn 18. And we give them the opportunity. We put the form in there that we have that gives the opportunity for us to communicate with the parent, with the consent of the 18-year-old, on the phone or through the portal, but it's able to be addressed to the parent, and showing that respect and that relationship that we've built with the parent over the years are some other things that we've been able to pull with the DAR that I think has been really helpful in doing a good transition for a number of reasons. But what we started realizing is, you know what, our 21-year-olds, they're going to be our parents in a couple of years. We want them to leave Pediatric Associates feeling like this is a great place that, yeah, I want to bring my kids there too. So really important that adult transition is a really smooth and friendly one, if you will.
Yeah, that generational care. It's funny. I'm certain that our audience has all experienced this, but it gets very emotional for our college-aged kids to leave their pediatrician. So I love that kind of incremental, like, hey, we're just tapping you on the shoulder to start thinking about this, start processing what this is going to mean, because it also, I'll never forget having a college-age kiddo that had seen their provider since birth. So 21 years, because it was the same in our practice. And she talked about how important it was to get that proactive notification, because she actually went out and started interviewing other, internal medicine, primary care adult physicians. So it allowed her the opportunity to interview other physicians to say, hey, who am I going to be as comfortable with as I was with my pediatrician, and begin establishing a relationship. So I forgot about that, Kateri. And not only are you, allowing that emotional space to process that it's time for you to move on, but then you're opening up your schedule for those newborns we talked about. So you're just constantly able to keep your schedule full, which is really important when we talk about having the finances to even open a new satellite office or add a new ancillary service into our practice that we may want to use to bring in some additional revenue. So I love that, Kateri, so much. So what I'd like to do, Susan, if you don't mind coming back on and showing us a few ways we use the DAR to look at growth for our practice.
Absolutely. All right. So we're still back in our DAR, the same place we had done our first demo for. But one of the things I think is really important when we think of all of the things that Kateri and Alisa were speaking about, in a lot of systems, you have to go find data. In OP, I think what is incredibly unique and what you have to think about is all this data that you put in because you need it for other reasons is already here. So when Kateri was talking about birth dates, right? I need my kiddos that are of a certain age, great. But when is their date of birth? That 17-and-a-half-year-old, or zip codes, or last appointment, or for our practices that may need to look at their kiddos that are VFC patients versus not, because maybe there's something different going on with your vaccines through your state. Primary and secondary insurances, last appointment, all of that data is actually already sitting here so that curiosity doesn't have to be overwhelming, it's at your fingertips. So when we think about, am I bringing in enough patients, my little ones? As you can see in my little practice here, Happy Kids Peds, I'm not. I have no kids under the age of 1, and I have very few kiddos here in my little kids versus really what my distribution is across the rest of my age. So yes, I need to go make friends with the birth facility down the street or the OBGYNs to get those folks that come into your practice. Or we talked about zip codes. How do I look at the distribution of my patients across those zip codes? And you know, it could be opening a new facility. It could be how you distribute your providers, or maybe it's the Little League team you want to sponsor. Where do I really want to do it that I have really a lot of my kids are pulling from? I can look at it and it's this simple. It is simply taking the data that you've spent a lot of time putting in to manage your population and simply resort it. Or if you're somebody who doesn't really want to look at zip codes and you want to do it by your cities and towns surrounding you, it's that simple as well. So it's the ability to look at your population of kiddos and simply then how else do I want to look at it? Now, I think it was Alisa who mentioned you may only want to look at your patients who have been here in the last period of time. Absolutely. That is also a piece of it. You're going to use the demographic analysis and recall to also continue to clean up those kiddos that haven't been in, right? We want to make sure our quality numbers are there, and we don't want to be dinged for kiddos that no longer are part of our practice. For our folks that are our billing team, or as Kateri mentioned, we're going to have that hard conversation with a payer because of reimbursements or whatever. It's this simple. What is my distribution across my payers based on my population of kids? And again, it's not a hard report to run. It is simply looking at my population and sorting it in a way that makes sense for you. So the ability to look at your payers, to look at how many kiddos are assigned to a specific PCP. So I clicked, so it's now highlighted on one of my providers. But it allows me to look at my distribution by PCP. There we go. In a way that it's simply, here is my distribution. So Dr. Craig only has 1 kiddo, but my other providers, how are they assigned to my different providers? So as simple as that, we have the ability to reach out to our patients, and just as a reminder, who are my contacts, right? So if I am reaching out to that kiddo that is over the age of 18, we have their preferred contact method versus having moms or dads or grandmoms, whoever is the guardian or adult associated with that kiddo. Alisa or Kateri, is there anything else that you think we could or should show our folks just to kind of get a broad overview of our DAR?
I do, Susan. Thank you for asking that, because while we're demonstrating how easy it is to put this information at our fingertips, I would say likewise, it's also easy when you mention the contacts on deciding on how you want to send those messages based on the preferred method of communication. Do you mind showing really quickly how easy it is to send messages?
Sure. this message button is always at the top of no matter which tab we go across. So if we look at that recall piece that we had here, that recall, in this case, it was that well visit recall. The ability to say, I'm going to send a message, and here is my IVQ recall. I was demoing that earlier today, and I'm going to do a preventative care recall. The recall messages are going to go out based on the preference of the parent. So it's going to go via phone, email, or text message based on what that parent has chosen. And what's nice is if mom needs a recall and she wants hers to be a text to cell, but the dad wants his to be an email to home or work, you can send these messages out to all of the parents or guardians that want and have the right to have that message sent to them.
Yeah, I absolutely love it. And I also loved how I could customize, to Kateri's point, giving that personalized touch, customize the message that's coming across as an adult consumer, and getting these sort of messages. I can tell it is not personalized. It's kind of a robo text, and sometimes it's even hard to decipher what do you get that too, Kateri? Because I love having that personalized approach.
Absolutely, and there's an unlimited number of these that you can create. That's really the point, right? It is on the fly for that blast message. We had a practice in the Pacific Northwest when we had the forest fires, actually. They sent a blast message out to all their patients who had asthma. Make sure your kiddo is, and the kiddo's name can be in that message. Make sure Harry, takes his inhaler with them. If you have any concerns or issues, please contact our office. It's a nice way to reach out and really ensure that those parents know that you are their place to give care to those kiddos.
Yeah, absolutely. And I think that's part of the power of having, a pediatric specific tool, because as you demonstrated, Susan, the dynamics of a family is very different today than it was 20 years ago. So being able to send a customized communication to the right person and in the right way that they want to get that information is so important. So thank you, Susan, so much for demoing all of that. I want to make sure that we have a little bit of time here to do an audience Q&A. So if you haven't already, Kateri and I will do our best to share with you some insights and answer the questions that you have. If you don't mind, go ahead and submit your questions. And Kateri, I think Doris is going to help us with the questions that have come up. So Doris, if you don't mind helping us out a little bit, that'd be great.
Absolutely, Alisa. And we have had just a ton of questions come in, so we will do our best to get through as many as we can. If your question is not answered today, we will absolutely have somebody to reach out to you after the webinar. So Kateri, this is going back to the first part of the webinar when you were talking about personalized recall messages. And the question is, are the personalized recall messages you mentioned customized for an individual patient or written en masse for a larger group recall?
Great question. So I usually do it, and Susan just kind of showed us with Alisa's asking how we're able to customize those. So when Susan pulled that up, she had a list of about, I don't know, 8 different things. I've got a huge list of them because I do them literally by age. So for me, I do it more mass. Now, the DAR is great for pulling those patients in. And what we saw is really big queries. You could do a query that includes 3 kids, and you could send a personalized message to the 3 kids or to 1 kid. So it doesn't have to be a huge group. So yeah, it's really easy to do either. I tend to do bigger groups, but that's just because that's what I've done. But great suggestion. Maybe I'll be doing more individual ones now.
Yeah, you really can kind of narrow the quantity and the scope if you choose, but as Susan mentioned, when there was a wildfire and, reaching out to your asthma kiddos, once you populate those, you might have your standard asthma query message that you would send, but quickly on the fly, you can customize that to that individualized group and say, hey, we understand that the smoke is heavy. Is your kid okay? Do you have your refill or asthma inhaler on hand? And so you can customize and individualize down to 1, 2, or 3. But even in those mass queries, customizing and tailoring that message to the specific situation just gives that little bit of a personalized touch. We hope that answers your question.
Thank you, Alisa. Kateri, there's another question for you. It says, we have been trying to tighten up our recall procedures for our practice. Are you willing to share your recall policies and procedures with us, maybe the most important ones?
Sure. In short, I do a little archaic, if you will. I use a spreadsheet, literally, and I go through my spreadsheet, and usually calls aren't sent out on Mondays because we're usually pretty busy. But every other day of the week, depending on what our call volume is and our and how much staff we have, I'll go through and I'll say, okay, yesterday 2-year-olds got messages. Today I'm going to send out 3-year-olds. Or we've got some extra time. Let's do personal calls today. And so we'll print lists, and so I have a spreadsheet that shows me by day, because I find it gratifying to know what I'm doing works. I look at the number, and so I'll run the DAR, and in the morning I'll say, okay, I'm sending out 200 messages, and then at the end of the day I'll run that same query to see that usually I'll have 20 to 25 appointments made. So the number of patients that show up in that same query decreases because they now have appointments scheduled. So I keep track of all that, and I can kind of see, and I can see when I started personalizing the message, the change in that. So I like to do it instead of having it scheduled so that it goes out the same time every day. I kind of switch it up a little bit, and that's also where I know that, right now I've got space in my schedule, so I can do those more targeted date ranges instead of broader date ranges. So for me, it's not a policy as much as a process, and part of that process is looking at what's happening in the office from a patient standpoint as well as a staffing standpoint. I hope that answers it. It's not an ABC cookbook for me.
Is anything ever an ABC cookbook? I mean, I'll never forget. There were some days I would be, a master of great intentions, and I would go through my scheduled, or like you, Kateri, like, what's happening in my practice, and it all depended on what was going on in the universe around us and inside our office walls. We might have a provider out sick, or to your point, we might have a couple of staff members out with a stomach bug, and it just kind of, I would have the flexibility to do it when at a cadence that was appropriate for our practice, because it was so easy and so quick. And so I did on my calendar, I would schedule time on my calendar, dedicated time to say, okay, let me go in and let me look at our recalls. What did I do last? What do I need to do? What's happening in our practice? And be able to generate those really quickly to get the results that we were looking for. Thank you for that question. That was a really good one.
I'm going to open this up to both of you as well. Question is there any way that the DAR can be used for patient balances, like over a particular dollar amount or age of the balance? Would either of you be able to comment on that?
I didn't use it that way. Kateri, have you ever used it in that way?
But I like it.
Susan,
yeah.
When you're out, do you ever have any practices that use it to look at balances? I would run some of my financial reports to look at patient balances, but I never got creative enough to use recall as a form of communication on patient balances.
No, and I'm kind of, my head's going, oh, I really like that too.
Yeah.
We used individual, right? We would look at it, and if it's somebody we wanted to, we use the messaging piece, right? Not the DAR per se, and we'd text mom and say, we need this or we need that. Where I come from in Pennsylvania, we're a high HMO state, right? And so people have to do coordination of benefits here, our police and our fire, right? Mom, you still haven't done it, right? So we used it for a lot of that, the message part of it, but not the recall. But I like that.
I do too. I don't know who asked that question, but I bet Kateri and I would really love to connect brains with you and check that out. Very creative thinking there.
It is. So we did something kind of a hybrid, and I didn't think of it the way the question was asked. But we actually took exactly what Susan was saying. So when my billing staff come across somebody with a COB, or 3 days before an appointment, or 3 days before on the schedule, we run the eligibility. And if we need an insurance card, but what we haven't done is used it for collection, and I think we're going to now. We actually use a status code. So we'll put in a status code of COB. We'll put in a status code of insurance card, run the DAR, send out a message to those patients, and then remove that status code. So it allows us to utilize the DAR for that on an ad hoc basis. So the insurance we send out every day. The COB, depending, we may send out every day, we may wait a day, just kind of depending on what's going on in billing and how that works. But that allows us to kind of put them all in a group together, and then mass send out that message. I have not thought about it for those with a balance and the potential to do it with that, to say, hey, you still have an outstanding balance, please contact the office. So yeah, more to come.
Yeah, I guess I just got kind of stuck in my way with my statements, and then, running my monthly financial reports and, picking up the phone and calling in addition to the statements. But that was, I think that's the best question yet, whoever you were.
All right, we have so many more questions, and I know we're over time, but we are going to go through a couple more. Susan, this one's for you. It's, how does a patient get added to a specific care recall, such as the ADHD or weight management? Is it problem list driven or diagnosis driven?
Actually, it's care plan driven. So when you think about a care plan, like everyone is enrolled in the Bright Futures care plan, the trigger is simply that they're a patient in your practice, of a certain age. For something like an asthma care plan, what is your trigger? Most people do a trigger of an asthma diagnosis, and there are multiples, and then that would enroll them in the care plan. Or if it's a med check, you may have different med check, right? Depending on, is it a kiddo that's on depression or anxiety meds versus ADHD meds, or you may not. But it's then, is it problem list SNOMED code, or is it the diagnosis? And you can put both triggers onto the care plan.
Yeah, and Susan, correct me if I'm wrong. So when we were going through our PCMH certification, and we were really getting into a good practice of building our care plans and those triggers that you're talking about, like any new process you implement, there's a learning curve. And so sometimes we might have found patients that weren't necessarily enrolled in the care plan to use the DAR. But if I recall, what I did was, you are able to do it based on a diagnosis and other variables, just to make sure that, all your kiddos with an asthma diagnosis are enrolled in a care plan moving forward. Is that's still correct, Susan?
It is. And what's really nice is you can also say, I want everyone who's qualified, it's a checkbox, versus enrolled. Right? So, which may have missed, right? So we have two different ways of doing care plans. Are they auto-enrolled automatically by having whatever the trigger is? Or is it a provider making the determination that they're in? And so two different ways. And let's say this is a kiddo that we missed, right? Or the problem list item got added because they went to a specialist, and now we would want them in, but they haven't seen our provider yet. We may want those kids in that care plan recall because they qualify for it, even though they haven't been enrolled in it yet because our provider hasn't seen them for that specific diagnosis.
That's right. I mean, care plans, DAR, the possibilities are endless here. The way at which you can get your information at your fingertips just really blows my mind, and not only speaks to the power of recall specifically, but the power of pediatric specificity. That's what's so wonderful to me.
Thank you. And this will be our last question. And then, Alisa, I know you have some resources that you want to share before we end the call. So the last question for the group is, we currently do not include patient name in recall messages. Do any of you include that?
I include the first name, yes. So with the tokens, you're able to put in just the first name or first and last name. I put in the first name, and I find that really helpful for families with multiple kids. When we didn't do that, we would get calls that said, hey, I know one of my kids needs to come in and I'm not sure who. And so it just took a little bit more time sifting through. Now, I will say, if one kid needs an appointment, another one might. So it's always good for the staff to look at that, but we do include first name.
That's great.
Thank
Thank you,
you.
Doris, for helping us out with the questions today. And as Doris mentioned, she sent me a little message that there's a lot of questions. And so Kateri, myself, and OP would be happy to answer those questions for you. I do have a few resources, if we want to bring them up on screen, that I'd like to share with you today. These are resources that will just build on what Kateri and I were discussing today and sharing with you. Again, there's so much you can do with this, so I encourage all of you to check out this blog. There are videos on, what recalls, how you can use recalls in your practice, and then of course the client success story from Kateri's practice. There's absolutely no way today that we could get into the full power of recalls with you, again, because there's so many possibilities. As long as you're curious, you can click a few buttons and have that information at your fingertips. I'd also like to encourage people and give a little announcement about an upcoming event that Office Practicum is having, which is OP Engage 2024, April 18th through the 20th at Caesars Palace in Las Vegas. So in addition to building upon this webinar and fireside chat today, we have over 80 unique sessions and educational opportunities at OP Engage to help you better utilize the system and be more efficient in your workflows in your office. We have a lot of industry experts that will be speaking here, and we've just bulleted out a few of the sessions that will be there to educate you further on recall capabilities and ways to maximize your schedule and continue to enable your practice to grow and thrive in your communities. So with that, I think we are going to wrap up. Thank you so much, Kateri, for joining me today. We love having you. You're an expert in the field and highly regarded. Thank you for joining our webinar today. Thank you, Susan, for your wonderful demos. And if you have the opportunity, we would love for you to fill out the survey to see how Kateri and I did, get your feedback. And if you would love to hear more from me and Kateri, please let us know. We are both happy to share our experiences with you. We both, Kateri's still, the CEO of her practice. I, prior to joining OP, ran practices for several years. We are a wealth of knowledge, and we are happy to continue this series on other topics or ideas that you would love to hear from us on. So I hope you have a great rest of your day. Thank you, Kateri and Susan.